I was walking through a high street in a mid-sized UK town the other morning. It was around 11 a.m. And you'd expect the usual Tuesday morning crowd, retirees, parents with strollers, the occasional remote worker. But what really caught my eye were the younger faces. There was this one guy, maybe 19, sitting on a park bench just watching the traffic go by. He wasn't in a rush. He didn't have a bag. He wasn't wearing a uniform. He looked perfectly capable, even sharp. But he was just there. And in that moment, he wasn't just a person. He was a living data point for a number that is becoming, impossible to ignore, 948,000. If you saw him, you might default to the usual grumbling about a lazy generation or a lack of grit. I mean, that's the standard script we've all heard in the news. But when you look closer at the reality behind that bench, the narrative just starts to fracture. Over half of these young people who are classed as NEET, not in education, employment, or training, are actually navigating chronic health conditions or, intense caring responsibilities at home. They aren't opting out because they're indifferent. They're getting snagged in the gears of a system that doesn't quite know where to put them. And what's truly striking, though, is how differently this scene plays out if you just hop across the English Channel. In a place like the Netherlands, that same young man wouldn't just be watching the traffic. He'd be part of a regional coordination structure that, by law, is mandated to keep track of him until he's qualified. He has a mentor. He has a path. It's a bizarre contradiction, really. We talk about the crisis of youth inactivity as if it's this unsolvable mystery of the modern age, yet the blueprints for fixing it are already sitting on desks in Denmark and Australia. If the UK managed to replicate even a fraction of that international logic, we wouldn't just be helping kids. We'd be injecting an estimated 86 billion into the national economy. So why are we still watching nearly 1 million people sit on benches? It turns out we don't actually need to reinvent the wheel to solve the UK's youth crisis. We just need to stop pretending the current silence is normal.
That observation, it perfectly captures the human reality of the crisis.
Right.
And more importantly, it sets up the core contradiction we really need to examine today.
Right.
The reality is nearly 1 million young people are excluded, but the blueprints for systemic inclusion, they already exist. So our mission for this deep dive is to move beyond the simple idea that Denmark or the Netherlands just have better programs.
It's more than that.
It's much more. We need to analyze the institutional logic that underpins their success. It's not just about what individual programs they run. It's about how they structure their entire system, their legal frameworks, their funding, their local responsibilities to track and engage and qualify their youth. We're looking for that structural scaffolding that makes failure to engage abnormal rather than accepted. And we're focusing only on policies that research shows are truly transferable to the UK context.
Okay, let's unpack this crisis right here in the UK before we go abroad. That figure, 948,000 young people aged 16 to 24, classified as NEET. It's just staggering on its own. It represents this huge pool of untapped human potential, and it's a massive drag on the economy. But the real tragedy and the statistic that I think utterly dismantles that lazy youth stereotype is the demographic reality hiding inside that number.
Exactly. When you drill down into the data, you realize this isn't a crisis of motivation. It's a systemic failure to support complexity. The most damning figure is that over half of this NEET population, so over 470,000 young people, are grappling with chronic health conditions, including mental health, or they have significant, intense caring responsibilities at home.
Over half. That just changes everything.
It changes the entire policy calculation. I mean, when over 50% of your inactive youth face these persistent health challenges or family duties, then traditional job search schemes, short-term placements, or even worse, benefit sanctions. They're not just ineffective, they are actively punitive.
So the problem isn't about getting them to apply for jobs?
Not at all. The problem is fundamentally one of holistic care and finding flexible, continuous paths that can accommodate disability and caring duties.
Okay, so if that is the primary barrier systemic failure related to their health and care, not indifference, then we need to be really surgical when we look at these foreign policy models. What specifically does the research identify as highly transferable interventions that could address this 50% health challenge?
We've got several categories of intervention that the research points to as highly transferable. First, you have the more universal work-focused ones. Tailored job search assistance, subsidized placements that lower the risk for employers, and proactive employer engagement schemes. These are relatively straightforward because they don't require, rewriting the entire benefit system.
But the really interesting transfer, the one that speaks directly to the UK's defining problem, has to be that specialized health integration.
Precisely. This is where we really need to focus. Specialized interventions designed specifically for young people with significant health conditions are vital. The gold standard model here is individual placement and support, or IPS.
IPS, right.
And this model is so effective because it flips the traditional approach on its head. Instead of getting someone job ready first, IPS uses a place then train model. It focuses on finding competitive employment rapidly, and then it wraps intensive, integrated clinical and vocational coaching around the person in their actual workplace.
So the support happens on the job.
On the job. This integrated approach, linking clinical support with the job search, is exceptionally relevant and transferable to the UK because it bridges the two systems, healthcare and employment services, that are currently failing this population.
And what other health-focused models are transferable? Because IPS sounds fantastic, but we're going to need a diverse set of solutions for that 500,000 people.
For sure. We can also look at highly structured models like Job Corps, which offer comprehensive education, training, and support services. Or, and this is crucial, the French-inspired social and preventive medicine consultations.
Okay, what are those?
These French policies focus on the early identification of health and social issues that are barriers to work. They actually mandate a consultation that's specifically focused on preventative health in the context of employment and training. Given the scale of chronic health issues among UK NEETs, adopting a policy that makes that connection between health and vocational pathways mandatory and proactive, it's a huge step forward.
That structural attention to health is absolutely key. But let's look at the demographics beyond health for a second. The UK has a slightly higher proportion of NEET men. If we try to import, say, policies that were highly effective in Italy or France, are we at risk of designing a system that only really works for young women?
That is the critical nuance we have to acknowledge. The research shows, for instance, that policies like the integrated program of active labor policies in Italy, or those French consultations, have, in their native form, been found to be statistically more effective for young women.
So we can't just copy and paste.
No, it means if the UK were to adopt them, we have to apply what you could call the adaptation imperative. Replication is not enough. We have to modify the outreach, the content, the format. Young men, particularly those who are disengaged, often require different points of entry, maybe more focus on tangible, practical skills or support delivered through different channels that feel less traditionally clinical or academic.
So failure to adapt means we only solve half the problem.
Exactly. You could end up addressing only half of the gender balance issue.
And this brings us to what you called the institutional mismatch challenge. We're talking about world-class policies, but if we try to force an Italian policy onto a UK institutional framework, what actually happens?
What happens is friction followed by breakdown. Adopting foreign policies isn't a simple copy-paste operation because policies are, well, they're intrinsically linked to their native institutional soil.
Right.
So if you take a policy designed for a well-regulated, highly unionized labor market, like the industrial frameworks in France or Germany, which rely on strong social partners and collective bargaining, and you try to plop it down into the UK's famously flexible, often fragmented employment structure, where union density is lower and gig work is so prevalent, the policy will inevitably fail to gain traction.
So the problem isn't the idea itself.
Look, the core difficulty isn't finding good ideas. It's recognizing that the UK's decentralized and flexible labor reality requires tailored, adaptable delivery mechanisms, even when the inspiration comes from more structured European models. We have to learn the institutional logic, that spirit of continuous engagement, while adapting the physical delivery to the UK's fragmented employment structure.
That sets the stage perfectly for the Netherlands. If the UK is fragmented and reactive, the Dutch model, particularly after 2015, seems to be deeply integrated, mandatory, and proactive. And the core shift here was this massive decentralization. What was the governmental logic behind handing over such vast responsibilities to local municipalities?
This was a deliberate, almost seismic political and administrative shift. It was codified primarily through three pieces of legislation: the Youth Act, the Social Support Act, and the Participation Act, all around 2014-2015.
And before that?
Before 2015, youth and welfare services were nationally managed, but locally, they were experienced as fragmented, confusing, and plagued by inefficient funding streams. The governmental goal was total transformation. To streamline all those services into integrated, locally adapted approaches.
So what specifically did the local municipalities take on responsibility for?
They took on the full continuum of welfare, support, and care for children, young people, and families in need. This included the entire youth mental health system, preventative care, specific welfare support, and even certain aspects of youth justice interventions. The logic was localization.
So the idea is that a local official knows the community better.
Precisely. A municipal official closer to the community should be better equipped to coordinate mental health services, welfare benefits, and educational tracking for a single young person, rather than that young person having to navigate 3 different national agencies.
That's a profound move towards holistic local responsibility, but we know from the critique that anytime you implement a change this radical, there are immediate and massive trade-offs. The evaluation found a major financial hurdle, didn't it?
Absolutely. The financial implications are a crucial policy lesson for the UK. The Netherlands Institute for Social Research, the SCP, they reported in 2020 that the transformation goals, while philosophically sound, were financially undersupported. Municipal budgets were being significantly surpassed.
How much were they being surpassed by?
Well, initial estimates calculated the total municipal costs just for the Youth Act alone to be over 5.4 billion euros in 2019. This resulted in an estimated budget shortfall of between 1.3 billion and 1.5 billion euros annually.
1.5 billion short every single year. That's a massive financial pressure. Why did the national funding mismatch the devolved responsibilities so badly?
It was multifaceted. Firstly, the initial estimates for the transfer just underestimated the true complexity and cost of specialized care, particularly youth mental health.
They just got the numbers wrong.
Fundamentally, yes. When local municipalities took over, they found the demand for specialized, high-cost care was much higher than anticipated, and the national funding formula didn't reflect that need. Secondly, while the intent was to save money through prevention, the necessary structural investments in local coordination took time and significant upfront cash, leading to overspending.
So the government had to step in.
They had to. The national government had to step back in, announcing extra temporary funding for 2019 to 2022 to prevent the local youth care system from basically collapsing under financial strain. It's a cautionary tale. It proves that local control only works if the national funder provides realistic, ring-fenced budgets for those specialized, high-cost services.
Okay, let's move to the legal scaffolding, which is the structural solution to that young man on the bench, the qualificatieplicht. How does this compulsory qualification legally mandate a pathway, and how is it practically enforced?
The qualificatieplicht, or compulsory qualification, is the absolute bedrock of their system. It is a legal mandate that young people must continue education until they reach 18 years of age or they obtain a basic qualification.
And a basic qualification is what exactly?
It's defined as at least a senior general secondary education diploma, a HAVO diploma or secondary vocational education diploma, and MBO level 2. This is key because it legally prevents youth from leaving the system at 16 or 17 and just disappearing into inactivity with no recognized skill.
But the UK NEET problem is primarily focused on that 18 to 24 age bracket. How does the Dutch system ensure that the tracking and support continues for that older group?
And this is where the monitoring mechanism kicks in and makes all the difference. Young people who are early school leavers, meaning they left without that basic qualification, between the ages of 18 and 23, are continuously monitored by the Regional Reporting and Coordination Center, the RMC.
The RMC.
Yes, it's a specific institutional body tasked with maintaining that engagement. The local contact municipality ensures these young people are tracked, their status is verified, and they are guided towards obtaining that essential qualification.
What are the actual mechanics of the RMC? When they identify a young person who is inactive, what's their regulatory power? Do they just send a letter?
Oh no, their function is far more active. The RMC is responsible for coordinating the return to education or training. If a young person is identified without the required qualification, the RMC initiates contact. They don't just offer advice. They have the power to require young people to engage in educational or vocational activities.
So there's real teeth to it.
There is. But the critical pressure point is actually on the municipality. The municipality has the legal responsibility to provide the pathway and the support. If a municipality fails to engage and provide the necessary services to ensure a young person meets their qualificatieplicht up to age 23, that represents a failure of institutional responsibility. It shifts the blame away from the individual and onto the system.
So it's an institutional commitment to continuous engagement for 5 crucial years after compulsory school. Now, moving from education to the labor market, how does this local focus integrate with the wider regional economy?
This is where the regional labor market structure plays a vital role. The Netherlands is divided into 35 recognized labor market regions, or arbeidsmarktregio's. These regions are the institutional mechanism for cooperation. They mandate close collaboration among all the key stakeholders, the local municipalities, the Employee Insurance Agency, or UWV, employers, and the schools.
And the goal is custom-made support.
Custom-made and informed by the specific current needs of that local labor market.
I understand that secondary vocational education, the MBO, is central to this whole model. How do they ensure that MBO remains relevant in a high-status path, unlike some of the, well, often derided VET options we have in the UK?
The governance of vocational training is highly formalized. There's a national advisory body, the Foundation for Cooperation on Vocational Education, Training and Labor Market, or SBB. Its role is systemic. It develops and maintains the qualification structure for apprenticeships in MBO, making sure the curriculum is current, relevant to what employers need, and standardized across the country.
So they're constantly linking it back to the job market.
Constantly. They advise the ministry on aligning VET and the job market. This formal integration prevents vocational education from becoming decoupled from real-world employer demand, which ensures an MBO qualification holds genuine currency in the regional labor market.
And as a practical example of this regional collaboration, we have the learn and work counters. This sounds like a physical manifestation of that partnership.
That's exactly what they are. The learn and work counters, Learwork Locket, are physical, regional meeting places. They are hubs where education representatives, entrepreneurs, employers, and government agencies literally meet.
So it's a one-stop shop.
It is. Their function is to develop targeted activities, coordinate arrangements, and crucially, provide independent career advice. They don't just guide students, they advise workers who need reskilling, job seekers, and employers looking to hire or train. They remove the fragmentation, making advice and coordination a seamless in-person resource.
Before we move on to Denmark, let's just revisit that holistic support required for that 50% of UK NEETs with health issues. What other social and health provisions are decentralized or targeted at vulnerable Dutch youth?
Well, the decentralization of youth mental health services under the Youth Act means that mental health support is managed locally. This allows for tailored, often non-clinical support to be integrated directly with welfare and educational planning.
And there's another really vital policy exception, right?
A very vital one. Youth care and foster care that began before a young person's 18th birthday can be extended to their 23rd birthday. This policy recognizes that the transition to independence is often delayed or more complex for vulnerable youth. It prevents that sudden structural cliff edge when they reach majority, which is a significant factor in UK youth homelessness and long-term inactivity.
That continuity of care is a huge advantage. And finally, what specific policy efforts are they making to address systemic barriers like labor market discrimination, which particularly affects young people from minority backgrounds?
The Dutch government has implemented concrete regulatory mechanisms to combat this. A special team was set up within the Inspection of Social Affairs and Employment, specifically to tackle labor market discrimination.
What does that team do?
They conduct targeted research on whether employers have a robust, measurable anti-discrimination policy in place. If an employer is found lacking, they are legally obliged to develop one. And crucially, this team has the power to issue fines to employers who fail to comply. It's a structural commitment. It says the system isn't just responsible for getting people qualified, but also for ensuring fair access to the jobs they're qualified for.
We've established that the Dutch focus is on this continuous mandatory engagement driven by local government. Now, let's pivot to Denmark, which seems to tackle the problem not from the bottom up, but from the top down. Massive, aggressive macro reforms designed to structurally maximize workforce participation for everyone, including youth.
That's the key difference. Denmark's strategy is built on a philosophy of economic resilience and high structural employment. They understand that a strong economy requires maximizing human capital across the board. Their sound public finances aren't an accident. They're the result of structural reforms implemented over many years, all designed to maintain a competitive business sector.
So their system creates an environment where work and education are just the default options.
The default economically incentivized options, yes.
And this isn't just a theory. They have hard quantifiable goals. What's their current target for maximizing employment?
The government has set an ambitious, measurable goal to increase structural employment by 45,000 full-time equivalents, FTEs, by 2030. This shows a real structural commitment to growth.
45,000.
And what's even more impressive is the pace of implementation. They have already achieved 31,900 FTEs of that target through measures that are already in effect.
How does a national government achieve over 30,000 FTE of employment growth so quickly through structural reforms? I mean, what specific economic levers are they pulling?
It's a combination of financial reform and, well, cultural adjustments. They implemented a big agreement on personal income tax reform to incentivize work. They eased access to international labor to fill skills gaps. And then there was the most controversial, but maybe the most symbolic move.
Which was?
The abolition of the Great Prayer Day as a public holiday.
They eliminated a public holiday to boost employment capacity. That seems drastic. What was the rationale and what was the projected impact of converting that single day into a mandatory workday?
It was a very public, very political choice designed to send a clear message. Maximizing structural capacity is paramount. The rationale was that the additional working day would inject productivity into the economy, specifically targeting sectors where output is constrained by operating hours.
I can imagine the pushback on that.
Oh, the political pushback was significant. It involved a religious holiday.
Right.
But the government successfully framed it as a necessary measure to maintain economic capacity and fund key public services. It shows an unparalleled level of commitment to their structural employment goals, a crucial contrast to many other countries.
Beyond just increasing the supply of work hours, what reforms are they implementing to improve recruitment and retention in key public welfare professions? Because if the UK's core issue is chronic health, a robust Danish health system must underpin their entire workforce.
You've hit on a vital point. They recognize that if their public sector, especially welfare and healthcare, is fragile, their overall economic capacity suffers. The government has focused heavily on improving wages and working conditions in public welfare professions to strengthen recruitment and retention. They're also actively encouraging existing public employees to work additional hours through various incentives.
Well, it's a two-pronged approach.
Exactly. It shows an understanding that structural success relies on two things: bringing new people in and retaining and optimizing the contribution of existing experienced staff.
They're also reforming their employment initiatives more broadly. The goal seems to be simplification, flexibility, and dignity. What is the scale of the financial efficiency they expect from these systemic changes?
The aim, as outlined by their governmental platform and an expert group from 2023, is to fundamentally rethink employment efforts to reduce bureaucracy and make services more effective. The resulting agreement on the reform of employment efforts, which kicks in around April 2025, is projected to yield a total permanent fiscal gain of DKK 2.7 billion annually.
2.7 billion Danish kroner. That's about 360 million euros.
Annually, yeah.
How does that simplification translate into that much money?
The gain primarily comes from two sources: increased effectiveness and reduced administrative costs. By simplifying the rules and procedures, moving away from a focus on excessive state procedural requirements, and box-ticking municipalities gain greater flexibility. They can allocate resources to initiatives that demonstrably work, rather than mandates that waste time.
So it's efficiency gains.
It's increased efficiency in matching people to the labor market, coupled with a huge reduction in bureaucratic overhead. That generates the fiscal gain. It proves that simplicity, dignity, and efficiency are not just moral goals, but financially rewarding structural outcomes.
Let's look at two policies that seem to directly counteract the UK's primary NEET barriers. So injury and lack of skills. How does Denmark handle workers who get injured and need comprehensive reskilling?
They view an injured worker not as a cost burden, but as human capital to be preserved. The 2022 agreement to strengthen their workers' injury compensation system specifically focuses on maximizing the connection between injured parties and the labor market. And the key lever is financial security during vocational training.
And what does that financial security look like in real terms?
It's extremely robust. The new scheme provides injured individuals with strong financial security during their vocational training, covering 83% of their previous salary.
83%?
Yes. That policy fundamentally shifts the calculation for an injured worker. Instead of worrying about how to pay bills on reduced benefits while retraining, they're financially supported to pursue a new vocation. This ensures a temporary injury doesn't result in a permanent shift into long-term inactivity, which is a major driver of the UK's health-related NEET crisis.
And this structural investment in education extends to the general unemployed population through the educational uplift.
Correct. The educational uplift is a permanent right. It came into effect January 1st, 2024. It allows someone to receive 110% of unemployment benefits, specifically when they're pursuing educational training.
So they get paid more than benefits to go back to school.
Exactly. It's a deliberate structural incentive. The state is essentially saying, don't just sit on benefits. Use this time to improve your skills, and we will pay you a premium to do so. It actively converts periods of economic inactivity into periods of structural enhancement for the workforce.
Finally, let's revisit the health issue. Denmark is clearly focused on maintaining workforce capacity. What structural steps have they taken to make sure their health system doesn't become the bottleneck that the UK's seems to be?
They were proactive. They recognized their national dependence on a stable public health sector, so they established a Robustness Commission back in May 2022. Its mandate wasn't just to look at patient care, but to address fundamental structural challenges in the system, ensuring task resolution and reliable access to trained personnel across the entire country.
So they're shoring up the foundations.
Shoring up the foundations. They've since implemented measures to increase incentives for staff to participate in irregular shifts, maximize working hours, and create better, more flexible frameworks for recruiting foreign healthcare professionals. This is structural economic policy, ensuring the health system is resilient enough to keep the workforce, including youth, active and supported.
Okay, so if we synthesize these two blueprints, the continuous mandatory tracking of the Netherlands and the aggressive macrostructural reforms of Denmark, what are the most impactful and practical integrated policy applications the UK could adopt right now?
I think the single most impactful transfer would be the Dutch concept of guaranteeing a minimum skills level, encapsulated in that qualificatieplicht, the compulsory qualification.
Right.
Allowing young people to leave school without at least that MBO level 2 diploma or equivalent, and then letting them disappear off the institutional radar. That is the key structural failure in the UK. Adopting a model that legally tracks and provides pathways to this minimum standard for young people up to age 23 would immediately address the qualification gap that traps so many.
But implementing that level of tracking requires a massive institutional shift, and it risks being seen as overly bureaucratic. How are the Dutch implementing that skills bridge between education levels in practice to make sure students don't fall behind early on?
They recognize that the transition between education levels is the most common place for vulnerable students to stumble. So they invest heavily in targeted scaffolding. For example, they have switch classes or Schakkelklassen, specifically for children needing extra support in the transition between primary and secondary education, especially those with language disadvantages or other learning difficulties.
So there's smaller, more supportive classes?
Exactly. They're designed to stabilize their skills before they enter the more rigorous secondary phase.
And they have similar programs for those moving towards vocational training?
Yes. The switch programs, or Schakkelprogrammen, operate at the secondary vocational level. These programs explicitly prepare students for moving up to a higher qualification level, like senior secondary or MBO. They are intensive, skills-focused programs that act as crucial educational off-ramps and on-ramps, ensuring a past difficulty doesn't become a permanent barrier. It prevents the drift that starts at age 16 in the UK.
Beyond just the curriculum, the Dutch actively link vocational education to employers through financial incentives. Tell me more about the Regional Investment Fund.
The Ministry of Education established the Regional Investment Fund on Secondary Vocational Education, the Regional Investing Fonds, IMBO. It was backed by a €100 million budget just for its initial period, 2014-2017.
And its purpose?
Its explicit purpose was to use public money to stimulate measurable cooperation between education providers, the public sector, and local business. The idea was to move vocational training out of the classroom silo and into the regional economy. This fund financed projects where employers co-design curricula, offer real-world training, and committed to hiring graduates. It ensures educational outputs genuinely match labor market demands.
Now let's pivot back to that defining characteristic of the UK NEET crisis, the mental and physical health barrier. We've established the Dutch decentralized mental health services. What specific targeted projects do they run to address the high incidence of mood problems and suicide risk among young people?
One exemplary project is STORM, which stands for Strong and Resilient Teens Minds, in the southern Netherlands. This is an integrated initiative focused on early identification and proactive intervention for depressive complaints among young people in secondary education.
So it's about prevention.
The key is prevention and resilience. It's implemented in the school environment, focusing on developing positive self-esteem, coping mechanisms, and resilience before mental health problems become acute. This preventative, school-based approach is highly transferable and critical for addressing the mental health component of the UK crisis.
And can large-scale public campaigns actually shift behavior around mental health?
Yes, research suggests they can be very effective in reducing stigma and increasing help-seeking behavior. The Netherlands ran a major national campaign called Signs of Depression as part of a multi-year prevention program. It specifically targeted young people aged 13 to 18.
And what were the results?
The post-campaign evaluation indicated that the general public and young people recognized more signs of depression, and importantly, they reported a higher willingness to seek help. It demonstrates that structural policy can and should include awareness campaigns as an effective first step.
Finally, we often overlook the non-academic scaffolding, the holistic skills that build citizenship and overall resilience, which are so critical for staying engaged. How is that embedded in the Dutch model?
It is deeply ingrained, extending far beyond the curriculum. They promote the healthy school approach, or Gezonde School, which is a national program linking education and health holistically. This framework includes promoting healthy lifestyles, prevention of substance use, and specific attention to well-being. Critically, yes. When the government grants support through this program, there is an explicit focus on schools with vulnerable student populations. It ensures resources are deployed where the need is highest, directly targeting the populations most likely to become NEET. And furthermore, citizenship and social competencies aren't just taught, they are structurally integrated and mandated in Dutch education. The development of these competencies is legally considered crucial, not just for a democratic society, but because these skills are proven to prevent school dropouts, stimulate learning, and lead to more job opportunities. The system sees resilience and social integration as structural prerequisites for vocational success, not just soft skills.
This deep dive has revealed a really striking difference in policy logic compared to the UK's generally reactive approach. We're moving from addressing the symptom, that young man on the bench, to proactively designing a system where that silent disengagement becomes institutionally impossible.
The core difference is the institutional commitment to continuous engagement. In the Netherlands, this means the legal obligation of the qualificatieplicht, backed by the local government's decentralized responsibility and regional coordination structures that legally ensure monitoring and a path to qualification up to age 23. The institutional machinery is designed to make the idea of a young person simply vanishing without a basic qualification, a policy failure, not an accepted outcome.
While Denmark's focus is on maximizing the structural capacity of the entire economy, ensuring that work is always the most incentivized, high-dignity option.
Exactly. Denmark uses aggressive macro reforms and strong financial levers, like the educational uplift providing 110% of unemployment benefits or 83% salary coverage for injured workers during reskilling. These are structural investments designed to make workforce participation and continuous education the clear default. They're solving the problem at the national supply level.
So the key takeaway for the UK is that it's not about finding a single program, but about adopting this structural logic of mandatory scaffolding and integrated support.
If the UK were to shift its approach from reactive, fragmented intervention to proactive, mandatory scaffolding for young citizens, the economic potential is immense. It could potentially unlock that estimated £86 billion into the national economy. That staggering figure represents the current cost of exclusion. The blueprints show that structural attention, legal monitoring, integrated health support, and mandated employer connection is the prerequisite for individual success. The true cost of the crisis is not just the lack of employment, but the institutional lack of a default pathway for nearly 1 million people, a silence that international comparisons prove is a policy choice, not a necessity.